Okay, we're all good. Yeah, thank you all for joining. And Sally, continue on with those introductions.
Thank you, Haley. So before we start, I want to acknowledge that we operate on the ancestral and unceded territory of the Coast Salish people, including the territory of the Musqueam, the Squamish, and the Tsleil-Waututh Nation. We recognize their ongoing contribution to the health and well-being of their community, and I also want to express my respect and gratitude for the opportunity to live, work, and serve on this land because of them. It is crucial that we honor and support the right, the culture, and history of Indigenous people as we work towards reconciliation and improving healthcare services for all of us, especially at this critical time. And here's our agenda today. So we are excited to have three outstanding speakers with us today, as you can see on the screen, Adrienne, Meghan, and Hanah. And each speakers will first have around 10 minutes to present and share their insights and the real world experiences. And after that, we will bring everyone together for a 20 minutes panel discussion where we will dive a little bit deeper and explain and explore some practical advice and lesson learned. So if you have any questions during the presentation or the panel, we encourage you to leave them in the chat box. And if we have time later on during the Q&A, we will try our best to answer. And I will give a quick introduction about our three speakers today. So first, Adrienne Cousins. Adrienne has worked in digital health for over 20 years, supporting the integration of new technology into clinical workflow. As a certified life coach and organizational change management professional, her approach is trauma-informed and human-centered. Her passion for people has led her to seek additional training in nonviolent communication, conflict mediation, and anti-racism and restorative justice. Hanah Van Borek. Hanah Van Borek champions teams culture and leadership to drive organizational and technological change. Over the past 6 years, she has supported healthcare transformation as part of rolling out our shared electronic health record system, aligning diverse teams towards a common purpose. Hanah also developed engagement plans and communication for CST Cerner initial go live and contributed to an EHR benefit evaluation framework, leading focus group and report design. Recently, she also helped devise a change management strategy to support the people transition from CST project to operation. And last but not least, we have Meghan Brenner-Burgoyne. Meghan is a manager of change management and engagement from the industry at the eHealth Center of Excellence, ECT, bring a wealth of expertise and experience to this role. So beginning her career as a registered nurse and a kinesiologist, working within the local health system. Throughout her clinical career, Meghan had the opportunity to work in areas like research, the surgery, the obstetric primary care, the chronic disease management, and education. Her extensive background in healthcare has equipped her with a comprehensive recognition of the intricacy of the healthcare delivery and the value of effective change management while implementing digital health solutions in clinical setting across the care continuum. So without further ado, let's first welcome Adrienne, starting with what is change management? I'm gonna stop share my screen. Adrienne.
Hi, thank you so much, Sally. Can everyone hear me and see the screen?
Looks good.
Wonderful. So I'm going to start with let me set my timer. I think I have 10 minutes. Is that correct, Sally?
Yes.
Okay. So I'll do a quick overview of what is change management to lay the foundation for the conversation and then the subsequent discussion. And then Hanah and Meghan will talk about specific project implementation interventions that they've used and some stories there for you. So before I start, I'll just ground myself on the territory of the Comox Nation, the Aixen, Pentlatch, Sisitla, and Setlut peoples, where I am a occupier and a settler of Celtic ancestry. As Sally mentioned in my introduction, a certified change management professional. That's with the Association of Change Management Professionals certification for CCMP, which is the Certified Change Management Professional, as well as ProSci. I'm a certified coach with the International Coaches Federation, which is the Associate Certified Coach, and then also with my school, which is the Coactive Training Institute. So that's the Certified Professional Coactive Coach, the CPP designation. And I'm a HIMPer. I'm a Bachelor of Science in UVic. And that's my dog, Asha. So very high level learning inquiry for us today for the next 9 minutes here. What is change management? Why do we need it? Is it an art or a science? I thought this was an interesting lens to bring into this conversation today. And then what framework standards exist? So this is a definition from me. There's lots of definitions out there. I really like to frame, well, it's the people side of change. That's very common. This is the image on the right is from ProSci. Organizations don't change, people do. The people side of change, it's a very common one. The second one there, OCM prepares individuals in an organizational culture to receive the change. That's something that I like to, a visual I like to kind of create, is we have all these things happening into the organization, including communications, training, events, celebrations, all these things happening. And change management is really looking at the overarching net effect, and is it being well received? Are we keeping pace with what the organization needs? Are we preparing the ground and the organization to receive the change? So it's really kind of like tending to the soil, you know? That's kind of a metaphor that works for me. It's about psychological safety. So again, this is, you know, coming from my background and my training. Organizational change management isn't so much about making people do what we want them to do on a particular timeline, even though that's kind of how we kind of use it. It really is about increasing the psychological safety of a change that's occurring within an organization. I prefer to use organizational change management so that it's not confused with ITIL change management, which, if people are familiar, it's the Information Technology Infrastructure Library. It's a, you know, there's standards and whole books around it. And they also use the term change management, and it refers to change control of a technical change in a system. So I prefer to use organizational change management. But then something that we talk about often in the industry amongst change managers is we don't like the word management because you can't really manage change. So often we will use other language like people readiness or transition support. So why do we need change management? This is obviously a slide from ProSci. If the end result of your project depends on people, which most often I have here, often it's 100% of our benefits depend on people, you really do need change management. Again, this is a slide from ProSci. They're great with research, really great with research and data. So this is based on ProSci research showing that you can increase the likelihood of success and meeting objectives by increasing the speed of adoption, speed of proficiency, and ultimate utilization of the project or the tool or of the change. So a note about problematic language. I do work with the Indigenous Digital Virtual Health Department, which is a new team within Provincial Digital Health and Information Services. So some of the language that I'm going to be translating as I go is we no longer use the word stakeholder. This is something that started to come up in project management circles. Instead, we'll use partner or interested party. I also won't avoid using the word adopt, and instead talk about adapting to the future state and meaningful use. Meaningful use was always a favorite term of mine anyway. So it just kind of, instead of talking about user adoption all the time, we'll talk about adapting to the future state and ensuring there's meaningful use. All right, so what is the being and doing of change management? This is a model from Canada Health Infoway showing how all these related disciplines actually together create this symphony of support for change. And so what the role of a change manager is to kind of help orchestrate all of these different changes into this one, you know, beautiful symphony. There's no single change plan, as this framework indicates there's multiple plans. We want to incorporate behavior change thinking and theory into all of these plans. And then the advice is to just pick a methodology and work with it. There's lots of methodologies out there, but it's important for it to be aligned to the organizational culture within which you're trying to influence the change. You want to align it with leadership culture, with any existing change culture that they have there, and then to customize it and measure back to see if it's working. So in the center of this framework from InfoA is monitor and evaluate. That doesn't indicate necessarily benefits of outcome evaluation. It really is about monitoring the plans. Are the plans working? Are the comms being received? So that's the center of the image there, is about making sure we're iterating and staying relevant and current and responsive to what people need. So that's the doing side. The being side I want to talk about is about accepting human behavior, normalizing resistance. It's very normal. There's a quote coming up that I really like around from Peter Senge. People don't resist change, they resist being changed. So just understanding kind of these basics really help navigate how to adjust and change your approaches. So be supportive, listening, honest, curious, using a coach approach, a really strong affinity between change management and coaching, a really great combination of skill sets, and looking for the win-win. A lot of the time people can feel that it's a zero-sum equation in when we're talking about change, but there's really, if you work at it, you can find the win-wins. And the strengths there, empathy, coaching, relationship building, alignment to vision. So visioning is such an important part of leading change. And then cognitive agility, again, ability to pivot and change plans and strategies and approaches as needed as we go based on feedback. This is a slide from Lean Change Management. I just pulled it right off their website, and I liked it a lot because it speaks to the being and doing as the art and the science. So that's kind of the conversation that that I thought I'd bring into this today. Is the process. They have the quote there from their website, that process is important, but who you are as a change agent is more important. When you shift your thinking about change management and combine that with lightweight tools, you've learned how to balance the art and science of change. I quite liked that. Daryl Connor, a quote from Daryl Connor, who's one of my favorites in this space. Change practitioners, the secret sauce of our profession isn't in our heads, it's in our hearts. Which is why it's really important to understand behavior change. So here's the quote from Peter Senge that I mentioned earlier. These are some fun slides. Apologies that the resolution's not great on one of them. Just that people respond to change in very different ways. What if we don't change at all and something magical just happens? Thankfully, I think in the health system, we've moved past that. We're very much now looking at innovation, embracing agile approaches to change. One false step, I might have too much change. And then there's, the top right-hand corner, like, let's just leaping. So very different individual responses, really pointing to the fact that it's personal. ADKAR, which is the behavior change model from ProSci, they have a lovely slide here that just shows how people go through those phases at different paces and different stages. But we're trying to track and help people support them through the change to make sure they're ready at the point of go live or the point of implementation. This is from, you might be familiar with this, Elizabeth Kubler-Ross's change curve that was developed to explain the grieving process, and has since been widely used as a method for helping understand people's relationships to significant change. And so from a change management perspective, people go through this at different times, at different phases of a project. People will go forwards and backwards on the curve depending on, oh, I didn't know that was changing. Oh, we have to do this also. So every single aspect of the change kind of has this curve that people go through as they realize that what's the full scope of this change? What's the full extent of this change? Oh, I'm okay with this part, but this part seems really confusing. So it is important to kind of understand this from a behavior change perspective and then have the right approach. So a listening and allowing space when people are on that left-hand side of the curve. There's a resilience point that's very personal for people. We can speak more about that maybe in the discussion or questions, but no matter how much support we provide as an organization, sometimes say someone's had a death in the family or someone's going through a divorce or something just is preventing that person from making it through this kind of resilience point, they're going to need more support. Like, so just understanding that even wonderful change plans with all the right things, we're still going to not necessarily be able to carry everyone through at the same time. On the right-hand side of the curve, we're looking at encouragement and celebration to help uplift. It can feel really flat and be almost harmful if we encourage and celebrate when people are still on the left-hand side of the curve. So that's just something to kind of note and something that change practitioners are always kind of trying to track and be aware of. We do a lot of tracking. Where are people at? In order to make recommendations of what would be the best approach. All right, so this is a fun slide from Cerner, just showing how that change curve can be, the amplitude and phase of that curve can be shortened and when you have the right support. So there are lots of frameworks. I'm not going to go through these at all. I'm just going to share with you my favorites. Change management one from InfoWay, we've already mentioned. ProSci, I like the 3 phases. It's based on Cotter, draws heavily on Cotter's model, the old school original framework there. ADKAR for a behavior change model is great. I really like this one from Influencer Model. It defines the minimum scope of interventions. So Hanah's going to be speaking to you next about the scope of interventions on the CST project. And so when we're looking at all the different things we could do on a project, we brainstorm all these ideas. I really always like to map it back on this model to see, are we doing too much even? Like, what's the minimum? And so the research here shows that successful influencers increase their chance of success tenfold by combining strategies from at least 4 of the 6 quadrants. So if I map this back and say, oh, we're only really doing peer pressure, so we've got peer networks. So say we've got peer networks and we've got training. That's only quadrant 2 and quadrant 3. We need some more. That's only 2. We need at least 3, ideally 4 quadrants covered in order to tip the scales and influence the change in a positive direction. All right. Shout out to the lean change management. They're redefining how change management is applied on Agile. Local instructors, Justin Belaski, he offers lots of courses, but you can learn and find out more about that on the Lean Change Management website. Professional certifications, I'm personally certified with the ACMP. There's also an organization out of Australia that's great, and they actually have a change management body of knowledge. They have 3 levels of certification, and they also have courses on enterprise change management. That is the end of my whirlwind overview of what is change management. Change is possible. People who change in their own time with the right supports. And I have some links that can be shared out to more information, really highlighting for folks that are within the health authority structure. There are ProSci courses available on Learning Hub. They're free. Please don't send everyone to ProSci training. It's very expensive. There are free courses on Learning Hub. Great. Thank you so much.
Thank you so much, Adrienne. I encourage everyone who have questions, leave your questions in the chat box. We should be able to answer your questions in the Q&A at the end. And then let's move to the next speaker, Hanah. So let me know if you can see the screen. And this is a very hot topic. Like, I'm sure our researchers are very interested to know the CST. So Hanah, please go ahead.
So I just want to mention I'm calling today from the traditional, ancestral, and unceded territories of the Musqueam, Squamish, and Tsleil-Waututh First Nations, specifically the village of Sunak, otherwise known by settlers as Kitsilano. And I'm committed to the eradication of Indigenous-specific racism. I'm continuing my education as a champion for the upcoming Moose Hide campaign. That's on May 15th, and it has a goal of ending gender-based violence. You can find more information about that on moosehidecampaign.ca. Hey. So I just want to share, I'm actually representing today as an ambassador for the change management and communications that supported the rollout of the clinical information system, otherwise known as CST Cerner, or the electronic health record. So this is work that's continuing in operations today in a partnership between the Provincial Health Services Authority, Vancouver Coastal Health, and Providence Healthcare. But yes, I'm an ambassador, so there's a lot of other people to give credit to who were behind the development of this plan. And I joined what was known as the CST project in 2019. I supported 2 back-to-back go-lives, the first with what was known as Burnaby Center for Mental Health and Addiction, which is today Redfish Healing Center, and then following that quickly St. Paul's Hospital go-live. And I supported numerous other go-lives. And so as I mentioned today, I'm part of the team that's continuing CST work in operations. I'm also supporting teams who ensure that other non-CST Cerner applications are functioning. So many types of tools and systems in healthcare. And I chose this photo of me running in a marathon race to just emphasize that going live is a marathon, it's not a sprint. So it's very challenging, but also rewarding. And before I begin again, I just want to reiterate, I'm an ambassador of this work. So there are many different teams who continue to bring lessons learned forward and improve change management with the rollout every single time we go live. So I just want to give credit to that of numerous teams and groups you can see on the slide here. And exciting to mention that today we have over 50 healthcare facilities and over 550 clinics that are on the system. So more than 44,000 staff are using CST Cerner today. So I'm going to now go into 4 phases of overview of this plan, and it's not specific to any particular health care facility or clinic, just an overview essentially. So the initial planning phase, the goal here is to enable leaders to champion the change while building awareness, understanding, and support. So it's really critical to have active leadership participation, not only in decision-making, but they need to be demonstrating their support and speaking to the benefits to their teams and really helping to rally their own healthcare site teams. So they're the ones that know their site, and so they're really important to work closely with so you can understand their people, their team culture, and they have insights on the risks and challenges for their particular site. Because even though there is a standard approach here, we are customizing it, we are honing it for the particular site audience. And that can be a little bit different depending on if you're a smaller rural healthcare site versus an urban hospital. So very important to adjust that. And to be able to communicate to your healthcare teams, you need to determine what the right channels are. And for the CSD project, they actually stood up a dedicated intranet or a one-stop shop for resources and information that was sort of separate from the healthcare site information. Another important part of this planning phase is recruiting peer mentors. So there's a big campaign and a lot of materials that go into supporting that. And peer mentors are the team members who learn the system before their colleagues. So they do additional training so that they can support their colleagues at the upcoming go live in their training and potentially subsequent go lives from there. And then they are key members of what we call a change network. So we're looking at champions at all different levels within clinical and medical teams, also various managers. We had names for those as specialty unit department leads or clinical area leads, depending on the site. And then informatics, who are absolutely critical. They are the bridge between the technical teams and the healthcare site teams. And as mentioned, peer mentors. And at this stage, we really want to emphasize reasons for the change, which are the benefits of CST Cerner. So improving the healthcare experience for patients, improving safety, improving the quality of care. We do that in a variety of different media. So we were using videos, testimonial stories, demos, on-site orientations, a couple of pieces you can see on the screen there. And then lastly, establishing an on-site presence. So this, as we called it, the CST Hub. And this is where we were building not only familiarity with the project team themselves being on-site, but they were getting more accustomed to know the culture of the site, while at the same time providing us a hub for teams to go for additional learning and support. So the next phase is support for engagement and learning. So the goal is really support training and readiness activities, show progress, gather feedback, and you're activating that change network we mentioned. It is really important for healthcare team members to be able to map in their heads and understand what is going to be asked of me with this learning. What is the time commitment? How is learning going to be rolled out? What can I expect? What are the learning outcomes? So they can start to mentally prepare for that and actually prepare their life for this big change that they're about to go through. So what you see on the screen is a piece that was essentially we'll call it a CST journey. For this particular group, it was the clinicians and clerks in the acute setting. So this is an example of a piece that we would use to help them track their learning. And also we would work closely with learning and informatics to track how those learning milestones were going and that they were being achieved and support the communication of those. And we want to make sure we're reinforcing the why. So one of the great ways to do that is to actually feature the healthcare site team's own people, their leaders. This was a little bit tricky in the beginning because we didn't have a lot of sites on the system yet, but as we progressively moved through the roadmap, we were able to gather more and more testimonials and feedback and actually have people talk to the benefits that were being realized within their teams. Again, tracking, Adrienne mentioned tracking, you're tracking the risks very closely, you're attending meetings, readiness meetings. You also want to stand up at planning committee meetings where you have key members who are on the ground, so you're getting a real sense of how things are going and you're tracking that carefully. Hosting leadership Q&As is also helpful. There might at this point be some misconceptions and misunderstandings about the change, so this is where you can quell that potentially. And I also thought it was really impactful when we would have champions from other sites who had gone through the change speak about their experience and talk about the learning curve and that it was really worth it for them in the end. So go live support, that's where you're about 2 to 3 months out and you're starting to plan for go live. So we didn't lead operations, but we did support some of the important areas that need attention. Like for example, service delivery, there may be some shifts to that because we know within the first days and weeks of go live, things are going to take a little bit more time. So you want to plan for that. You want to plan for temporary workflows where we have teams that might be working in 2 systems at the same time, the legacy system and CST Cerner. So there's specific impacts to address around that. And then what we call cutover. So that is a massive undertaking and it's the move of information from legacy systems and paper charts into CST Cerner. So a massive amount of work has to go into that. It's a big team effort. And so very critical to be communicating and monitoring that within the days and lead up to go live. And we would also support our healthcare teams with some tools to communicate to their patients, their clients and families. Again, language a little bit adjusted and also translating that into multiple languages so that it's easy to understand for people within that local community. This is a really important resource you see on the screen here. This was a quick reference guide. So at this point, you also want to make sure that the healthcare teams are feeling confident in the type of support they need. So the goal is to identify areas for risk mitigation. You're instilling confidence in that support and you're building on readiness. So this is an example of that. And you just want it to be a no-brainer for healthcare teams to get support, understand the multiple tiers of support, whether it's in person, or it's online. There were Zoom tools included. So we had lanyard cards printed so they could easily know where to go to support when they need it. We would prepare for issues, be ready to have some messaging to go for that, or and also have a very clear path of escalation should issues arise. Having all of that ready beforehand, very important. At this point, you're engaging with your community and health sector partners, so BC Emergency Health Services, for example, your nurses unions, your medical associations, so that they understand and they're aware of what their members are about to undertake. And planning potentially for a celebration or some type of recognition that's in alignment with their team culture and their capacity during go live. And then the go live period is a very exciting, very full on time. So this is where we're collecting feedback, we're acknowledging achievements, monitoring and adjusting the approach. So lots of documentation of that time when I was on the project. We were gathering testimonials and photos almost every day, and we were giving recognition. So some sites decided to be a little creative with that, depending on what they wanted to do. I know BC Cancer would actually have various symbolic ways to represent that turning on the switch. You can actually see there's a 3D printed switch that was used. Depending on how things are going for the site and how they perceive the change to be going, you may want to have a celebration. They had candy carts going around, so just showing some acknowledgement and recognition and appreciation to the staff for all the work that they're doing, because it's such a huge undertaking. Multiple touch bases are important throughout the day, so you're attending meetings, and sometimes issues would change from morning to afternoon. So really supporting where the learning needs are, communicating out what the problem areas might be and how staff can get support for that. And then we would try to gather, if we could, some preliminary stats on how things are going to start to, again, show that there's some positive results here. And it's important to communicate regularly. So just working really closely with the leaders and champions, maybe adjusting the message where needed. And honestly, that message could be adjusted, like I said, from morning to afternoon. Things could take shape a little differently. And then gauging opportunities for improvement as you go along. Maybe certain methods are not working as well to reach the staff, or we're not seeing the shifts we want to see. And then being ready to transition to what you call sustainment, which is regular data operations. So starting to roll back some of the support and possibly getting back to some of our regular operations now that hopefully your healthcare team members are getting more and more comfortable with using the system. All right, so I've put together on the screen some success factors. These are ones that I picked myself, but I also have drawn from what I've heard colleagues talk about. So it's really important to have a strong team culture. It can be really beneficial because you may already have some of the camaraderie in place and the support and encouragement to undergo something like this. And also they may be used to rolling out various changes to begin with, so they have their own processes that you can tap into. Similarly with like operations and structures that are in place, if you have to start to stand those up closer to go live, it can create a little bit more, it creates a lot more work. So it's better to have these things really solid beforehand. Like I mentioned, active and engaged leaders, absolutely key. And having hopefully good governance so that you're making decisions quickly. The partnership between the project team and also the site team is, you want to make sure there's transparency and a lot of collaboration so that if depending on what each side is going through, they can be really transparent with each other and be able to support where needed. And that's where flexibility comes in as well. If things are changing, you want to be able to respond nimbly. The next slide is just, this is a slide that was developed by the CST project leadership team. So some of the elements I just spoke to, but I wanted to show this is what they call sort of their CST secret sauce for success for an implementation. And then I think the last slide is just a visual. Oh, sorry. I did want to mention evaluation because I am talking to a research audience. So there was an evaluation done in 2023, or I should say a framework for a future evaluation was created. And they were able to measure over a 6-month period a limited number of KPIs, but gave a series of recommendations for how to continue that work. So anyone interested, I can send a link later if people want to check that out. And then this will be the last slide here, is just a visual to show all the contributors to just the last slide here. Yeah, it takes a village. So these are all the various healthcare teams and project team members over 6 or more years who contributed. So it's just want to give a lot of acknowledgement, and I feel very grateful to be able to represent this work today. Thank you.
Thank you so much, Hanah. There are a lot of great discussion and question actually in the chat box. So before we move to the next speaker, I just want to mention if you and Adrienne has time, you can continue share your insights there. And I will back to share the screen for Meghan.
Perfect. Thank you so much, Sally. So today I have the pleasure of sharing a bit about the eHealth Center of Excellence, who we are, what we do, and specifically how we do change management in the digital health space. So we can flip to the next slide. Excellent. So the eHealth Center of Excellence, or the ECE for short, is a not-for-profit organization based out of Kitchener, Ontario. We work to support clinicians and organizations with the meaningful and sustained adoption of digital health tools. Our mission is to be the leading trusted digital health partner for primary and integrated care. We know are known for and excel at change management, but we also provide a lot of other services, including program management, knowledge translation, and evaluation programs. We have a co-design lab called HEAL, where we work directly with clinicians from across the country, admin staff, and allied health to identify pain points in clinical workflows and then develop solutions to help solve those real-life issues. And we also have SHIELD, which is an accredited cybersecurity and privacy training program. Scoot to the next slide. So day to day, our team supports and works with many different tools in many different areas. Some are listed here. We support technologies and tools like e-referral, virtual care, online appointment booking, EMR or electronic medical record tools, and also automation. We have a team that builds bots and works within those EMRs. And we also work in the AI space. So things like AI scribe and assistants and such. All of the work that we do, we aim to enhance clinical care and streamline healthcare processes, and we do this with a foundation of change management as we approach and support clinicians in all of these areas. And I should note that clinician is the term that's likely repeated throughout this presentation. We work an awful lot with physicians and NPs, but we also work a great deal with administrative teams and nursing teams, allied health professionals, all members of healthcare teams across the healthcare sector. So as I mentioned, we're based out of Kitchener-Waterloo, Ontario, but we do work across Canada. So perhaps you've worked with someone on our team somewhere along the way. We are working in lots of different spaces, including data standardization, population health, primary care practice improvements, virtual assistants, and evidence-based decision-making. We're involved in several provincial e-referral adoption programs, as well as deeply involved in the AI scribe space, among many other areas of work. So we work and support clinicians one-on-one beside them at their desks, all the way through to collaborating with provinces for deployment of large-scale provincial programs. So we'll jump into the change management space specifically in all of that. So change management at the ECE. Our approach is deeply rooted in a commitment to clinicians and supporting that full end-to-end process, which, as we've heard from my co-presenters, this goes far beyond that initial deployment of a tool. It's more about that sustained and meaningful use of the tool. At the ECE, we incorporate tools and thinking from practice facilitation, implementation science, and co-design spaces into the way that we approach change management. We've supported over 15,000 clinicians since 2014 with the successful adoption of digital health tools, and clinicians continue to indicate positive experience with a 97% satisfaction rate with our approach and our supports for change management. So what do we do and what makes our approach so successful? So we have our model grounded in our mission, driven by strategy and guided by the quintuple aim. And then we have some elements that are really foundational for successful change management, some of which my colleagues have already mentioned. But building and maintaining that strong relationship is something we value significantly in our organization. We partner with clinicians, and they will email us a year after we've worked with them about something completely different, asking for support. And even if we aren't that one supporting that project or that work, they know that they can trust us to connect them with the right person. So we really value that relationship and spend a lot of time to provide fulsome support to build trust with the clinicians or their teams. Collaborating and co-design to identify gaps. Oh, sorry, back to that slide, Sally. We actively involve clinicians, admin teams in the planning and implementation of a tool or a process or whatever that change is. So it's very important to have the right people involved at the right time. We want the perspective of different roles that could be involved in that workflow change engaged at all the right points during that conversation. So this might mean in a primary care clinic, for example, we might have the physicians and the NPs and the nurses involved in the start, but then they need to step back, and we really need the administrative team, and we need to work directly with them for a period of time. And then maybe the nursing staff shifts back into the engagements. And all of that shifting is great. It's really just identifying the right people at the right times. Building capacity for change management. We have change management as a part of every project that we support. It's foundational to the successful adoption and use of any tool meaningfully. It's one thing to deploy a technology, for example, to hand out a license or tell someone, start using this something. But it's another thing to really provide wholesome change management support and fully support embedding that change into their day-to-day workflow and ensuring that it's something useful for them and that it's been adopted and it's their new normal. Utilizing a custom approach, we have to shift the way we support from one clinic or one person or one group to another. One size does not fit all in the change management space. One tool or an approach that worked well for one project or even for a group within the same project might not work for another. We have to consider that person or that group, social factors, the tool or the program that we're supporting, and then best match change management tools or approaches to support that person or that group, considering all of these factors together. Pacing the change, that was already mentioned by my colleagues, but sometimes we're able to move really quickly through a change. We might have a group that's ready to go. It's a good time in the year for them to take on a new initiative. They might be digitally savvy already, and we move really quickly through a process. And other times, not so much the case. We might need to be more available, offer different types of support, and we have to pace that change with what they are available and what their resources are available to support as well. And then adjusting the plans is similar. We have a plan that aligns with a project plan, but we have to build in space for adjustment. We work really closely with our evaluation team and are constantly measuring and evaluating the work that we're doing. And we're using that information to adjust our approach real time. It might mean taking a step back and repeating some part of the process with a group or making a change to an approach that we're currently using so that we're aligning best with the support that that group really needs. We can flip to the next slide. And I just mentioned our evaluation team. And again, speaking to an evaluation group, I will highlight that another foundational aspect to our change management approach is our close collaboration with our KTE or Knowledge Translation and Evaluation team. So change management is foundational to all of the work we do at the ECE, and KTE or Knowledge Translation and Evaluation is embedded into all phases of that work. So knowing what process or workflow we're enabling with technology absolutely supports our ability to get that meaningful adoption. And during all project phases, we are constantly operationalizing research and evidence-based materials and real-time clinician or end user feedback to respond to user needs. At project completion, or sometimes during the program or project, depending on timelines, we complete evaluations with clinicians or groups or the partners that we're working with to demonstrate and explain benefits and challenges. So the next slide. So when we operationalize all of this, what does that look like? These are 6 stages that are typically involved in our change management approach. This is a framework. Sometimes it changes, and it's definitely not always linear. Sometimes we move back and forth, or depending on the group and the change that we're supporting, we have to edit the way we do things. But in general, we kind of have these 6 areas that we move through. We generally start with relationships, spoke to this in the previous slide. It's really helpful to get to know those that we're supporting. We have a motto of meeting the clinician where they're at. So knowing that everyone is at a different point in their career, they have different interests, their understanding of their EMR or their electronic medical record is different, and their desire to adopt a technology is not always the same. So we can't have a one-size-fits-all mentality, and we need to understand that person to really build the trust in order to best support them. We always talk about workflow. So this is the space where we have those conversations that sound something like, show me how you're doing it now. That type of conversation so that we can understand the current process and make sure that the change best aligns with how that individual clinician or that group currently operates. So we have, conversations that sounds like, what does it look like when you send a referral to orthopedics right now? Who fills it out? Do you print something out? Do you have a physical paper that you then put into a fax machine and send? Tell us about those steps that you need to take to complete X, Y, and Z. We ask a lot of questions and we listen a lot in order to best understand those workflows. When it's time to introduce the change, we do it in a way that we think will align best with a clinician based on all the factors that they've shared with us, their clinical processes, the resources that they have available to them, and then the parameters of the project. Customization, typically, this is an aspect to consider when we think about things that the clinicians have available to them, the way that their workflow works. Do they work in a solo practice? Do they have a group practice with resources available? Thinking about how we ensure that whom we are training or what we are training on or supporting aligns with their space and their unique situation. Pacing the change we've heard about. This is when we're thinking about what works best for that clinician or group. Sometimes it looks like a few virtual sessions and maybe some emails, and that clinician feels comfortable after a short period of time, they're good to go. This is not the case for others, and they might require far more support and in a different type. They might want to be in person or virtual with several support sessions, and we just have to pace the way that we introduce that change. Reinforcement and making sure that change is sustained. So how do we support to make sure that that tool or that change is ingrained in their day-to-day and a new part of their routine, not something that they try for a few weeks and then kind of set aside and dismiss. We lean on feedback cycles and best practice in the evaluation team to help inform this space as well. So I have a project example here, and noting that we are getting close to time, I will scoot through this. But this is an example of a program that we supported where primary care offices were introduced to patient forms, which they could send to their patients ahead of time via email, or the clinics were also provided tablets. The patient could complete the form upon arrival to the office or clinic. For your understanding, a patient form is a secure form that a patient completes some sort of an assessment. Real-time scoring happens of that assessment, and then the results are sent directly into the patient's chart for the clinician or administrative team to act on immediately. Forms are anything. It can be something like email consent, data or demographic update, a screening, something like a well baby visit, or a mental health screener like a PHQ-9. So the goal of the program is to, sorry, back to that slide, Sally, is to streamline workflows, improve efficiencies within the clinics, and also improve the patient experience. This took part in one part of a province over about a year and a half. 39 primary care offices were involved. They ranged in size from about 2 to 20 physicians and NPs. And then they also all had nursing staff, allied health potentially within their clinics. During that time, over 200,000 assessments were completed and 25,000 patient experience forms were also completed. Some very incredible results from this work. Happy to share and chat about those with anyone offline after, because it was really interesting, a lot of this feedback. But the change management considerations, which we're here to chat about, some of the things to consider and lessons learned were, again, about the right people at the right time. So in most cases, clinics were signed up to participate by their physician lead, for example. But we learned very quickly that the workflow of the physician was the least impacted potentially by the use of a tablet or the patient form. When we walk through that workflow of, for example, obtaining consent or having the patient complete a well baby or mental health screener on a tablet, it really impacts the nurse or the admin staff. So at first, physicians were signing up, joining the planning meetings, but the more questions that were asked, we were having those workflow conversations. Show us what it looks like when you do X, Y, and Z. The response was often, I'll have to ask my nurse or my admin team and get back to you. So important to know that, right? We had to shift direction, pivot. How about we meet with the nursing and admin team? We get some of this sorted out, we go through these details, and then we'll connect back in with yourselves once we have things mapped out. So good lessons learned. In some cases that didn't happen for whatever reason. And you can imagine it's significantly more challenging then, because we have the folks who are most impacted by a change not involved in the planning or how the change would actually take place. And then noting time super quickly, importance of workflow and staff preferences, having those discussions with staff, still on this previous slide, Sally, sorry, being able to offer demos. I'll wrap it up there. We can, happy to chat more about this after. I know we're definitely over time. Thank you so much for having me to chat about change management and the ECE.
Thank you so much, Megan. I know we're a bit over time, and I do have a few questions prepared, but let's see how many questions we can go with. So maybe, Adrienne, I will start with you first. From your experience, what are the biggest challenges in implementing change management in our healthcare? Like, how have you addressed them? And of course, Megan, feel free to chime in if that resonates with your experience at ECE.
Thanks, Sally. Yeah, thanks so much, Megan, for your presentation. I loved learning about what you're doing at the eHealth Center of Excellence. And thanks, Hanah, as well, for sharing all those details about CST project. It's such a tremendous effort. So I would say resources are one of the main challenges, and just also culture. And Hanah mentioned it, or the organizational culture. And same thing, even with Megan, like just the culture of the clinic where the conversations had to start with the physician, versus walking into a clinic where the admin team would have already maybe been at the table from the beginning. And so sometimes it's just a lack of understanding of what we're actually trying to do, but definitely resources and then having the right people at the table. And by resources, I mean change management leads. So people like Megan, Hanah, myself, that often isn't budgeted on projects, or it is budgeted late on projects. So making sure there's not just a lead, but depending on the size of the project, a team of change management experts. It's not just a checklist, as we heard many times from Megan and Hanah and myself, just we're constantly adjusting. And it's about timing of things, not just, oh, these are the things we need: a peer network, we need training, we need comms, we need to look at the workflow integration. It's the nuance and the timing of all of that, and making sure we're bringing people along and we're not losing people along the way. So yeah, that speaks a lot to sponsorship and also project management culture as well. So really partnering with project managers and having those dedicated resources. Thanks.
Sally, can I jump in with a question from the chat here?
Yeah.
Anna says, I'm in Quebec and our 34 site organization has embarked on a major digital health transformation. Our physicians are not employees of our organization. They work on it, but are paid by our AMQ. And our autonomous workers, we are struggling with this group. Oh, I'm gonna unmute
Your echo, I think.
Sally, can you mute for a second while I read the question here? We are struggling with this group because they do not feel that they need to use the new electronic medical record that we'll be implementing. They do not show up to meetings and are not cooperating. Do you have any tips? So I'll open this up to kind of all the speakers if anyone wants to jump in.
There were some great answers in the chat. I think Tibor, social settings can be helpful, taking people in smaller groups to understand what's going on, really listening, hearing the stories. That all requires trust. And so that's, I think Megan on your slide starts with relationship building, right? I think that was on Megan's slide there. Absolutely starts with relationship building and being creative around how to do that. So I just wanted to call that out. That's a great comment in the chat. Megan, Hanah?
I was just going to say, oh, sorry, Megan.
Go ahead. Go.
I was just going to say, if there's opportunities to attend meetings for that particular group that are obviously they're separate because they're not being paid through your organization. If there's an opportunity to sit at maybe a committee table or have a conversation with their leaderships to support the change and get them to help champion it as well, because it does start with leaders often, but also love the suggestions I'm seeing in the chat.
I haven't had a chance to catch up on the chat, but one thing to consider could be really having a conversation with them about why not, right? Like why is it not of interest to them? And then kind of flipping those responses on identifying the value then. So there's a reason why they don't want to do it. Is it, we're close to the end of our career? Is it that we're not interested in the cost? Is it that we just like paper? What is the reason? And then helping using those responses to help us form, well, here's a value, consider these as positive, depending on whatever the reasons that they don't want to make the change are.
Yeah, and I would just point back to that change curve. If we're too quick to point out the benefit without acknowledging the challenges, it just becomes kind of dismissive of their concerns. We really want to acknowledge the concerns, really want to repeat back, I'm hearing you, I hear the concerns, these are valid concerns, and start from that place of mutual understanding. And like Meghan said, understanding like, what is it about that? Like, and just having empathy. Like, yeah, you're at the end of your careers and I get it. Like, this is tough. So start from that place of connection and empathy and understanding, and trust that you'll get through that together and then carry them through the rest of the curve. But if they're getting stuck there and we're over here trying to talk about benefits, it's just not going to land.
Thank you so much. Any more questions from the audience, Haley, before we move on?
I want to send a lot of love out to Hanah. It's a really tough situation, and sometimes they just have to fail and learn through experience. That's also another thing. Like sometimes you just have to let them do it and be there for the sustainment and the reinforcement side of the equation.
Thank you, Adrienne. So next question for Hanah and Meghan, like, can you both like also share a key lesson learned from a specific change management project that had a significant impact? Like, can you just walk us through that a little bit? I know we don't really have time, but maybe I'll go with you, Meghan.
Yeah, I can quickly summarize one, and I think I touched a little bit, but having the right people involved in the work at the right time is always so important to consider. You want your champions to support the work, involving different groups at different points in the project. It could be slightly different depending on the project or the scope of the work, but always making sure that you've considered and included everyone who will be influenced or impacted by the change at the appropriate times. Making a decision and not including the people who are the potential, end users, and then dropping something on their laps later on is not going to land well. So making sure that you involve those folks at the beginning of the conversation and then have them help move through the change process. Similar is that importance of, along with that, is keeping people engaged. So up to speed with project information. What are the goals? What are the benefits for them, as we just sort of chatted about there? What are the benefits to the patients potentially that they support? How are things progressing? What to expect next? And having a source for feedback provision is also really helpful so that you can real-time meaningfully act on what your team or those that you're working with are feedback they're providing.
Thank you so much, Hanah.
Just seeing that we have 2 minutes here. I think impact analysis is really key. And thank you for that excellent answer, Meghan. Impact analysis is key. Sometimes there's this sense of, well, it's not a very big change because there's not as many people involved. But when you look a little bit deeper, if you're looking at the change, it might be a change in the system that touches a lot of different systems. Well, suddenly now you've got quite a complex change that you're looking to roll out. And if that change also has a fundamental shift to how, for example, a healthcare team's practicing, that could actually end up as being an even larger change because now it needs to be expanded beyond even the scope of the healthcare site that you're looking at. So it's hard to estimate a change. Sometimes on first glance, you think it's going to be small, but it ends up being very complex with many different layers.
Thank you so much. I know we just have 1 more minute. We might go over like just a few minutes, if that's okay. So how about let's just wrap up with some advice, and then I will back to you, Meghan. Like if you could just give one piece of advice to organization, like, looking to improve their change management approach, what would it be from your industry perspective?
I would say one size does not fit all. And my colleagues mentioned this. There's so
Yeah.
many great models and approaches and theories out there. we don't have to pick one and follow it through start to finish. We need to be flexible. We have this toolbox of knowledge and strategies, and then we need to tailor our approach to what best suits that current situation, the people or the group that we're working with. We don't need to follow that full process and use every tool or every form that goes along with it. It is not a one-size-fits-all approach.
Thank you so much. Adrienne and Hanah, do you have anything you want to add on before we end?
I think one of the things that came up when I was chatting with Hanah and Meghan before this was we really think there's an opportunity to partner more with research. That we would love to partner more. And like Meghan mentioned, the eHealth Center of Excellence is partnered quite closely with the knowledge translation and evaluation. And so there is a real affinity between change management and evaluation, outcome evaluation and KPIs and all of that. It's a big part of the story of the change. Why are we changing? What are the outcomes? And then and then you got to close that loop. Did we achieve what we said we were going to achieve? And often that's a little fuzzy, right? That's a little fuzzy, can be. So there's just a huge opportunity for our mutual disciplines to support each other in telling that story of the change. So I'd like to put that out there. We need your help.
Yeah, definitely. Okay, that's already 101. I think today's meeting is over. Thank you so much for everyone joining our session today. We will share the slides with you if the speaker agree. And our next one is June 26th. So stay tuned and please come back. Thank you so much.
Thanks, Sally. Thanks, everyone.
Thank you.